Dear students, welcome back. In the previous session, we have discussed about the ligamentous system of the spine. In this session, we are going to discuss about one of the ligament, that is anterior longitudinal ligament, in detail. So as we know that the ligamentous system is classified into two types. One is intersegmental ligamentous system and another one is intrasegmental ligamentous system. In intersegmental ligamentous system, we'll find three ligaments. One is anterior longitudinal ligament, posterior longitudinal ligament, and supraspinous ligaments. The other three ligaments which are present in the segmental ligamentous system or the interspinous ligaments, okay, ligamentum flavum and intertransverse ligaments. Okay, out of these 6 ligaments, in this session we are going to discuss about anterior longitudinal ligament in detail. So in this session, from where to where this anterior longitudinal ligament is going to stretch, and what are the types of fibers present in the anterior longitudinal ligament, and what is its important functions. Okay, yes. Now we'll see the anterior longitudinal ligament. The anterior longitudinal ligament is associated with the interbody joints. So these are associated with interbody joints. Okay, the anterior longitudinal ligament runs along the anterior as well as the lateral. So here we will find anterior view and lateral view. So the anterior longitudinal ligament runs along the anterior as well as the lateral surfaces of the vertebral body from sacrum to the C2 vertebrae. Okay, so this is the extension. So the anterior longitudinal ligament runs along the anterior and lateral surfaces of the vertebral bodies from the sacrum to the second cervical vertebrae. From there, it is also having a extension from C2 to occiput. From C2 to occiput, they are called as anterior atlanto-occipital as well as anterior atlanto-axial ligaments. So here you can find this one is the axis, that is C2, and this one is C1. Here you can find the occiput. Okay, so here this is the anterior longitudinal ligament which is going to extend from C2 to atlas. C2 to atlas is called as atlanto-axial ligament. From atlas to occiput, it is again extend. That one is called as atlanto-occipital ligaments. So these two ligaments are the extensions from the anterior longitudinal ligaments. Okay, yes, again we will see here. The anterior longitudinal ligament has two layers which are made up of with thick bundles of collagen fibers. So the two layers are superficial layers and the deep layers. Okay, the superficial fibers which are present in the superficial layers are long, okay, and bridge several vertebrae. These are going to bridge several vertebrae, okay, from sacrum to the C2. Okay, whereas the deep fibers are short. The deep fibers are short and run between the single pair of vertebrae. So it is going to run in between the single pair of vertebrae. It is run in the single pair of vertebrae. Okay, so the deep fibers blend with the fibers of annulus fibrosus of the intervertebral disc and reinforce the anterolateral portions of the intervertebral disc as well as the anterior interbody joints. So this is one of the important function of the anterior longitudinal ligament, that it is giving stability to the spine on the anterolateral aspects. Okay, and if you see the development of the ligament in different regions, okay, it is well developed. So the ligament is well developed at the lordotic regions. We can find the lordotic regions at the cervical and the lumbar regions, and also a little substance we can find at the thoracic kyphosis. Okay, so the anterior longitudinal ligament increases in thickness as well as width from the lower thoracic region to the vertebrae of L5 and S1. Okay, the tensile strength. So wherever you will find the collagen fibers, those fibers are capable of having more tensile strength. Okay, there are two type 1 fibers. The tensile strength of the ligament is greatest at the high cervical region. We'll find C1, C2, C3 or the high cervical region. Okay, so the tensile strength is greatest at the high cervical, lower thoracic as well as the lumbar regions. Out of these three also, the lumbar region is having greatest tensile strength because of its thickness and the width of the anterior longitudinal ligament. Okay, so this is about the strength of this ligament. And another ligament, that is posterior longitudinal ligament, which is also associated with the interbody joints. But if you compare the tensile strength of both anterior longitudinal as well as posterior longitudinal ligaments, the anterior longitudinal ligament possesses 2 times greater tensile strength than the posterior longitudinal ligament. Okay. Now we will see another function of the anterior longitudinal ligament. What happens during mobility to this anterior longitudinal ligament? The anterior longitudinal ligament is going to compress during flexion. It is going to compress in flexion. Here the spine undergoes flexion. So what happens on the anterior aspect? So here the fibers are going to compress during flexion. Okay, if you see in extension, what is going to happen here? The anterior longitudinal ligaments are going to stretch. The anterior longitudinal ligament is going to stretch. So what happens if anterior longitudinal ligament is going to stretch? That means the anterior longitudinal ligament is going to limit the extension. It is going to limit the extension of the spine. Okay, so not only from L5S1, that is from sacrum to C2, and in the regions of the cervical, higher cervical, that is in extension from C2 to occiput also, it is going to limit the extension. So this is one of the important function of the anterior longitudinal ligament. What happens to the anterior longitudinal ligament during flexion? It is going to compress. What happens during extension? It is going to stretch. What happens if it is going to stretch? It limits the extension of the spine. Okay, another important thing. So during flexion and extension, so the ligament is going to compress in flexion. In extension, it is going to stretch. what happens during neutral position. Okay, in neutral position, the ligament becomes slack. That means it is not showing such kind of deformation what we have seen in the flexion. Normally, during in neutral position, it becomes somewhat slack. It becomes somewhat slack. Okay, and it also becomes slack when the normal height of the intervertebral discs are going to reduced. Okay, so if the intervertebral disc size is reduced, then also in neutral position the anterior longitudinal ligament is going to be slack very much. Okay, because what is going to happen, the space between the two vertebrae is going to decrease. Then again what is going to happen, the anterior longitudinal ligament is going to become slack. Okay, so when this intervertebral disc is going to reduced, when the nucleus pulposus starts degeneration, then the size of the intervertebral discs are going to reduced. In that condition, the anterior longitudinal ligament becomes slack even in neutral position, more slack. Okay, so these are all the function and the structure about the anterior longitudinal ligament. In the next session, we are going to discuss about the posterior longitudinal ligament. Thank you.